So it's a new year and many people are celebrating dry January. That means they're not consuming any alcohol for an entire month. But did you know it's almost impossible to actually have a blood alcohol content of actually 0.00? Really? How does this happen? So what happens is there's certain bacteria in the human digestive tract, mainly Klebsiella pneumonia, and Enterobacter species, such as Enterobacter cloaca, that produce what we call endogenous ethanol. What they're doing is they are breaking down glucose and other sugars into pyruvate via the glycolytic pathway. Glycolysis is a pathway that is very common in just about every organism on the planet. And these organisms, then that pyruvate that's produced from glycolysis under anaerobic conditions, meaning without oxygen, they're in the gut and you're breaking down under anaerobic conditions, you're not going into the citric acid cycle and therefore you're undergoing fermentation. And so if you undergo fermentation, you're producing ethanol and carbon dioxide in alcoholic fermentation. There is also some Saccharomyces cerevisiae present, as well as E. coli in your gut, and in these cases they will also undergo alcoholic fermentation. Saccharomyces cerevisiae is called baker's yeast, where they make bread in a bakery, or they also use that same species of bacteria in breweries to make ethanol in alcoholic beverages in the beer and wine industry. So naturally you have some of that in your gut. Now, if you have particularly active bacteria in your gut, you could actually have Auto Brewery Syndrome, and this gives you an extra large amount of alcohol in your system. In some rare cases, it could exceed 0.08 milligrams per deciliter, which is the legal limit for driving an automobile in the United States. This is exceptionally rare. Most of the time, endogenous alcohol never exceeds about 0.01 milligrams per deciliter. So you really don't have to worry about it, the production of ethanol in your system, but it does happen.